It is no more shameful than any other medical condition. It's something that happens, and it's, an infection that people live with.
I'm one of the people here actually living with HIV. I've come across the stigma and everything in day-to-day life.
I walk into shops, people see a solid face and automatically look at store detectives behind me.
What we would like to see for the workplace is people feeling able to disclose their HIV status and get support from their employers.
For me, a lot of it is about, in terms of leadership, people actually putting themselves at the heart of the discussion and the debate. When we have people standing up, telling us about what the issues are in society.
Welcome to the conference today, See Beyond, which has been organised by the Terence Higgins Trust, South Lanarkshire Council. Indeed, I think all the Lanarkshires are here today.
Today was about looking at how we view HIV, how we view hepatitis, and how we view sexual health in society, particularly within Lanarkshire, but really just trying to sort of debunk all the kind of prejudices and attitudes that we have around sexual health, good sexual health, and around people who are at risk of and living with HIV or hepatitis.
Any of you that know me will know how passionate I am about sexual health and bloodborne viruses. I've spent my entire career devoted to them, and I continue to do so from my post within the Scottish Government. And to be fair to the Scottish Government, I think it speaks volumes that despite the huge remit of my current post, which Leslie thankfully has detailed so I don't have to, the government have employed someone like me, who essentially is a sexual health and BBV physician, to take forward the whole of my remit, but really concentrating on sexual health and BBV.
Possibly the biggest challenge to testing is the fact that bloodborne viruses are not in the GP's quality.
Practical thoughts on anyone who's doing something at the moment.
They're having to repeat their story again and again.
And a real tension with that, I feel, as well, is that
Individuals taking on board what they think other people think of them.
There was a lot of information that people heard today from the Scottish Government and from other partners within Lanarkshire around innovative practice, around some of the issues that they've been facing, the challenges and the barriers they've been facing, and how they've overcome some of those, which was really, really interesting and encouraging.
I think I probably learned a lot more than I taught, which is the way it should be at these events. I mean, I was absolutely thrilled to be able to give the plenary talk, both as a physician but also representing Scottish Government on an issue like stigma that's so absolutely important, I think, in society, and we take very seriously. In terms of being able to learn things, I think the perspectives from the service users are always absolutely invaluable, and just the examples of really good practice that are going on in Lanarkshire at the moment, I think, are very inspiring for all of us.